This is Damian McNamara of Global Medical News Network, and I'm at the American Association of Suicidology annual meeting in Orlando, Florida. And with me is Dr. Michael F. Myers, who's the Vice Chair of the Department of Psychiatry at SUNY Downstate in Brooklyn.
Well, I think some of the messages I would have to deal with paying attention to that loss and to not try to deny it. So whether or not your life has been touched by suicide in your own personal family, or perhaps by a very close friend or colleague, and that certainly happens in our field, that we lose colleagues to suicide because we're an at-risk group as doctors for suicide. But also if and when we've lost a patient to suicide, to really deal with that and to see how you can grow in terms of looking after other patients. There's a real sense of, not all the times, but there can be a sense of shame, personal loss, of obviously feeling guilty and blaming yourself, but feeling in a way that this isn't supposed to happen. And yet the nature of our work is such, is that we do look after people with serious mental illnesses, and it's known that somewhere between 85 to 95% of people who die by suicide have been living with some type of psychiatric illness, whether it's been treated or not. So it is part of our work to confront that, and I always make sure that I talk with medical students about that who are considering a career in psychiatry, as well as, of course, my residents who are already in the field and in training. The one thing that jumps out at me immediately, there are several, but the first one is don't isolate. And so even if you are somebody who's actually working in a small community, and sometimes psychiatrists are, and there's no one there, get on the internet. We have a clinical survivor support group through the American Association of Suicidology. The American Foundation for Suicide Prevention also has a whole track for physicians. Those are just two things, as well as, I'd advise the person to call up colleagues from medical school or colleagues who work in the field of mental health. And the other thing, too, not to worry about is that attorneys will tell us sometimes not to talk about it, just in case there's litigation. And that's true, but what they mean is it is okay to talk about our feelings associated with the loss of the patient. So it doesn't mean that you have to kind of bear this completely on your own, and so therefore you can reach out to family members and friends. Those physicians who are spiritual may talk to a religious counselor. Others will talk with a therapist too, and that can be very helpful too.
This has been Damian McNamara with the Global Medical News Network.